Hi, my name is Ben, and I'm going to show you how to administer an IM injection for our patient, Mr. Tutu. The first step is to check Mr. Tutu's MAR against the prescriber's order. So, on Mr. Tutu's MAR, we have Fluvarin, 0.5 milliliters, IM, one time only. Against the prescriber's order, Fluvarin, 0.5 milliliters, IM, one dose. Next, I'm going to check Mr. Tutu's MAR for any history of allergies to see if that prevents him from getting Fluvarin. He does not have any allergies, so that should not be a problem. After that, I'm going to check the vial of Fluvarin to make sure the information is consistent with the MAR. So on the vial it says Fluvarin, 0.5 milliliters for one dose, MAR, Fluvarin, 0.5 milliliters for one dose. Now we can begin to prepare the injection. For this, since we are administering to the ventral gluteal site, we're going to need a 3 milliliter syringe and a 1.5 inch needle. So, screw the needle on. Okay. Next, I am going to wipe the top of the vial with an alcohol swab to prevent any contamination. And I'm going to do that in a circular motion. Okay. Now I'm going to aspirate 0.5 milliliters of air into the vial, and this will make it easier for me to withdraw the medication. And I'm going to aspirate this amount of air into the air portion of the vial. Okay, now I can begin to withdraw the medication. If there's any air bubbles, knock the syringe side till they reach the top. Okay. Now, eject any excess medication. Now after this, normally I would change the needle tip, because if I inject it right now, the needle tip is coated with medication and that could irritate the patient's skin. But because we are limited in terms of supplies for this demonstration, I'm going to use the same needle. So in this case, I'm going to put the safety cap on. Next, since I prepared the medication away from Mr. Tutu's bedside, I'm going to label the syringe so I know what it is. So on the label, I'm going to write Mr. Tutu, Fluvarin, 0.5 milliliters, and the date of administration, October 19th, 2015. I'll put it here on the syringe. Now I'm going to take the supplies I need to the patient's bedside. An alcohol wipe, piece of gauze, some gloves, which I have in my pocket, prescriber's order, and MAR. Hi, Mr. Tutu. My name is Ben. I'm a student nurse in my second year in the collaborative program at George Brown and Ryerson, and I'm here to help administer a shot of Fluvarin, which is a flu vaccine and will help prevent you from getting the flu. Tell me your name, please. Okay, tell me your date of birth. At this point, I would check the patient's wristband and see if the name is correct according to the MAR. On the wristband, his name is Mr. Tutu. On the MAR, Mr. Tutu. Now I'm going to do my third check of comparing the medication information on the MAR against the prescriber's order. So we have Fluvarin, 0.5 milliliters, IM, one time only. Fluvarin on the prescriber's order. Fluvarin, 0.5 milliliters, IM, one dose. I'm going to check my syringe as well, make sure the information is consistent with the MAR. So on the label, 0.5 milliliters, and on the measurement, 0.5 milliliters of Fluvarin, MAR, Fluvarin, 0.5 milliliters. Mr. Tutu, Tell me, do you have any allergies? Have you had any seizures? If he has said no, then I can get ready to prepare the medication, to administer the medication. So now I'm going to do hand hygiene. Okay, after I've performed hand hygiene, I can put on some gloves. Okay, now I'm going to take my materials over to the bed. Okay. Mr. Tutu, I'm going to get you to lie on your side for me. Please turn over. Once Mr. Tutu is on his side, I'm going to assess for any bruising, swelling, redness. If I see any of those signs, I cannot administer the medication at that site, and I need to pick a different IM site to inject. I see no bruising, I see no redness, and I see no swelling. I can begin to landmark the area. So, with my non-dominant hand, I'm going to put my palm on the greater trochanter. I'm going to point my thumb towards the client's groin. My index finger is going to point towards the ASIS, and my other fingers are going to point towards the iliac spine. The injection site is going to be in between the index finger and middle finger, right here, in the center of this triangle. So, I'm going to landmark that site, or just put this here so I know where it is. Then, with an alcohol swab, I'm going to wipe around that site in a 5 centimeter radius, or 2-inch radius. Next, I'm going to get my needle prepared. Okay, now I'm going to, getting ahead of myself here. For the purposes of this demonstration, I'm going to use this injection pad here. Okay. So I'm going to stretch the skin of Mr. Tutu, make sure it's nice and tight with my non-dominant hand. With the syringe, or with my dominant hand, I'm going to hold the syringe like a dart, and I'm going to inject it at a 90-degree angle. Then I'm going to stabilize the needle with my non-dominant hand. Next, I'm going to aspirate the needle. I must make sure that there is no blood in that area, because if there's blood, that means I've hit a blood vessel, and I need to start over, change my syringe, change my needle. I see no blood, that means I can inject the medication. I'm going to inject it 1 milliliter for every 10 seconds. 1, 2, 3, 4, 5. Now, I'm going to hold this for 10 seconds. Get my gauze ready. Now I'm going to withdraw this after 10 seconds. And this will facilitate absorption. By putting a gauze pad here, the gauze pad will facilitate absorption. I'm going to cap the needle, and then I can dispose of it at a later time. So, I can take the gauze pad off. Now I'm going to dispose of my needle. Mr. Tutu, how are you feeling? Good? Okay. I'm going to come back in about 30 minutes and I'm going to check and see how you're doing. I'll take my supplies away. Now I can do some documentation. So I'm going to write the time of administration, 1600, fluverin 0.5 milliliters, IM at the ventral gluteal site. Write my name, Ben Ornstein, from the Bachelor of Science Nursing program, and the date of administration, October 19th, 2015. In 30 minutes, I will check on Mr. Tutu and assess